Hello, my name is Dr. Lewis Gilbert.
And I'm Dr. Amanda Gilbert.
And today we're going to bring you information on COVID-19 antibody testing. We have received so many questions from our patients, our family, and even our friends regarding the new recommendations on COVID-19 antibody testing. And we want to give you, our listeners, our viewers, some important information on COVID-19 antibody testing.
So let's throw it back to Biology 101. Let's imagine that this foreign invader, this virus, somehow makes its way into the body. The immune system knows it needs to mount an immediate immune response. So with that, it gathers in the soldiers, calls in the troops of our antibodies to fight this foreign invader. So the antibodies and the immune system have won the battle. However, the immune system is so smart that it knows it's going to keep some soldiers around, these antibodies. So in the event that nasty foreign invader virus tries to come back, it'll be ready to take on the fight again.
So let's talk about COVID-19 antibody testing. So you go to the doctor and you ask for the antibody test. You receive your results and the results come back positive. This means that you likely came in contact with COVID-19 and your immune system mounted a response, and now you have antibodies to show that you fought off the COVID-19 infection. But if your test came back negative, that means that you likely were not in contact with COVID-19 and therefore you do not have any antibodies to show.
So unfortunately, as of now, the CDC is still working on validating an adequate test. So you may have heard of different commercial labs or even your healthcare provider who's offering antibody testing, but there's no standard amount of how many antibodies you have that really will mean that you have immunity. So if you remember, like the chicken pox, we can test for titers, and because of a lot of research, we already know how many antibodies or the level of antibodies you need to have immunity from the chickenpox virus. We haven't gotten that far in research yet with COVID-19. So in terms of the testing, it's still a little bit up in the air.
So in regards to COVID-19 diagnosis, antibody testing is not used for diagnosing COVID-19. We still recommend that you use the PCR swab testing that you can get from your healthcare provider. The CDC right now is only using COVID-19 antibody testing for research purposes. So take all of that into account.
So how does all that information apply to you? If you do have any of those symptoms of COVID-19, which include fever, dry cough, loss of taste or smell, or any GI symptoms like diarrhea or vomiting, definitely give your PCP, your primary care doctor, a call and let them know. As Dr. Lewis said, the standard of diagnosis is still going to be that PCR nasal swab that we do. Now, if you do want to go ahead and get the IgG testing, talk it over with your doctor. Just know that that does not necessarily mean that you're immune. It's still very important that we're practicing social distancing and following your local public health guidelines.
Thanks for tuning in this week. Don't forget to follow us on Instagram at Marriage Ministry and Medicine, and also subscribe to our YouTube channel, Marriage Ministry and Medicine. We look forward to seeing you next week. Be blessed.
Bye-bye.